James has been a constant through the years, and I think James' demeanor, the things that he does extra for our patients that most folks don't even realize that maybe work with James, the extra touch, the extra care he might provide to them, has really set a bar for us, and set a bar for the other employees to reach for in terms of the compassion that's shown towards our patients.
James is the orthopedic tech, so he works a lot with orthopedic patients on the surgical floor, but he'll work anywhere. Anyone will call him, from ICU to medical to surgical to special care. And James will go and help the patients, settle them, will help bathe the patients if they need to be bathed. He's just a great support to the patient, to the families that are there.
When you call James to come and do a task, he doesn't hesitate. If he's busy, he'll say, "I'll be down there in 10 minutes," and he's there. He's loyal to his patients. If he has a patient in the unit and he comes and takes care of them, shaves them, bathes them, turns them, he will come back the next day to see if they need anything. And James is committed to the staff and to the patients.
I've never once, and I can honestly say this, heard Mr. James complain. Never once. Most of us do, and he doesn't. He teaches us to be humble, and no matter the patient's color, their financial is just no different. He treats them all the same, and that's a good witness for us. He always checks on us at the end of a shift and to see where we are. And if a patient maybe has been in ICU and he's helped with them, he follows that patient to the floor and comes by and checks on them, and he knows their needs, and he may tell us what they like and what they don't. And it just means a lot. It means a lot to the staff and to the morale of the hospital.
He has always had a special way with patients. Although he's got a lot of great skills, it's his compassion, his kindness, and the way he just presents himself to patients and the families. And in order for him to have that support, we have to give him support. You know, James doesn't complain because we trust him enough to listen to him and follow his lead on things.
James being here helps our nursing staff. It allows them to do other things while he's taking care of some of the patient's needs, and that's an operational issue. But I think it's reassuring to the patients, and it it oftentimes can help them even heal quicker and get back home.
Well, I wonder if he sleeps much, because I think he does jobs when he leaves here at night. He goes and helps people get put to bed, and he gets up the next morning and helps people get dressed before he comes in. And then before his shift starts, he also goes by and checks on other people. And when they come into the hospital, they always ask, "Is Mr. James here?"
He's real. There's nothing fake about James. He's a real person that has a real heart, and really displays that when he's taking care of his patients.
I never had a complaint, and I love what I'm doing. And through God, He made everything possible. And I love the staff and everybody, because everybody in this hospital is a family to me. Upson Regional Medical Center have a good group of people, and I'll be here maybe 50 more years, if the Lord permit. But once again, I would like to thank GHA for this honor.